Ma'am, to start with, what do you mean by pronunciation difficulties? Is it seen only in children?
Okay. To answer that question, as the program title itself says, pronunciation difficulties, it is seen in a person where the speech clarity is not there. So when the person speaks, the listeners cannot understand what is spoken clearly, and it can be seen in both children and adults, and more so in children. Very commonly, it is seen in children. And for to give a few examples, maybe when the child is saying book, it is said as buth, or for lorry, it is said as lolly, which means to say that there are several types of speech sound errors or pronunciation difficulties. One of the most commonly seen is like substitution errors. That is, for one sound, the person uses another sound. Like for in the example what I just said, for book, the child says book. So for car, the is used. And many times for sir, and all that, some difficult sounds of the language, the person might use some other sound. So such errors are called as substitution errors. And sometimes there may be distortion errors. Distortion errors in the sense the sound is spoken, but still it is not very clear to the listener. They feel that there is some problem with the way it is spoken. Similarly, there could be omission errors, that is, the sound itself is not produced. To cite an example from children's speech, for school they might say wool, or for shoes they might say oo, oo. That means some sounds are deleted or omitted there. And all these types of errors constitute a speech sound disorder, and such difficulties are called as pronunciation difficulties. So, what really happens is when there are such errors in their speech, they become very conscious and they cannot speak with the listeners properly. Their social interaction is compromised to a large extent, which limits their interactions with people around them, and it compromises their quality of life itself, not only of the person, of the family itself. And there are several causes for such conditions.
Ma'am, how common is this problem?
This problem of speech sound errors is not very uncommon to say. There are several studies done in the Western countries. In India, also several survey studies have been done. And a few studies to mention. I'll start from our institute itself. In 2002, we had a school screening program report released, and which says that around 13.4% of the school children have some form of communication disorders, and the major chunk of it was speech sound errors. So that says that speech sound errors are not uncommon. They are quite commonly seen in school children also. And also other reports say that, to cite our own annual reports, Aish annual reports, consecutively for the past 5 years, it was seen that around 7 to 8% of the speech language disorders we see here are under speech sound disorders. So that also says it is a significant number. And in the Western countries also, several research reports say that around 10% of the school going children are affected by speech sound disorders. So it is a highly prevalent condition, so which has to be intervened at the earliest.
Thank you, ma'am, for your inputs. What causes this problem, ma'am?
Actually, there are several causes which attributes or which causes the pronunciation difficulties. I'll discuss a few of them, which are quite important ones. One of the main causes is structural issues. So, if an individual has some structural malformations, for example, in children, children born with malformation in the tongue, especially if the tongue is tied to the floor of the mouth. Such condition is called tongue tie condition, wherein the tongue is unable to move in the oral cavity freely. So the children might have problems in producing the tongue tip sounds like t, d, r, l. These sounds will be unclear for them to say. Another condition is malocclusion of the teeth. As the child grows, and if the teeth set is not aligned properly, if the occlusion is not appropriate, the way in which the air is diverted in the oral cavity, that can be affected. And a few individuals you would have seen that they might have overjet, underjet. These are some malocclusions in the teeth which can be corrected. And if not corrected, they will have problems in saying sounds, especially sounds like s. They would have problems. These are some minor structural issues. A child born with a craniofacial anomalies, for example, cleft lip and palate. So, if they have cleft of lip or in the palate, the roof of the mouth, if there is a gap, then the air moves into the nasal cavity and it resonates there. So, whatever the child speaks, it is going to sound quite nasal and it will be very unintelligible. It will not be very clear to the listener. These are some structural issues that can be seen in children causing pronunciation difficulties. In adults also, these structural issues can be seen after a road traffic accident or a trauma or infection or after if they have a tumor of the tongue or in the mandible, and post surgery they'll have to remove a part of the tongue or part of the mandible. This also can have distortions in their speech production later on. So these are the various structural issues that can be seen. One of the major causes of impaired speech clarity is hearing impairment. Many of them still are not aware that hearing is very important for our speech language development. So if there is a child who is born with a hearing loss, the whole of the speech language developmental milestone as well as their skills will be affected. And also if there is a hearing impairment which is of very lesser degree, that also can cause, that also can be seen as pronunciation difficulties in that particular child. So hearing is very important, very vital for our speech language development as well as skills. Another set of cause is neurological causes, wherein in children who are born with brain damage, like that condition is called as cerebral palsy, and also children who are born with underdeveloped brain, for example, intellectual developmental disorders. In these conditions, they will have generalized problems with respect to speech language skills. They will not be able to acquire speech language skills normally. Along with that, they will have pronunciation, definite pronunciation and clarity issues in their speech. Meanwhile, in adults also, they will have difficulties with respect to pronunciation because of some neurological insults. For example, stroke or dysarthria. They would have such issues because of which, you know, their pronunciation can be quite affected. Also, in certain cases, it is seen, in certain cases, there might not be any cause. Many people believe that, will believe that, you know, the cause is always present. Okay, so those causes also can be, should be looked into.
Thank you, ma'am. Thank you for the answers. Please note that we'll be back in 10 minutes. Live will be resumed after 10 minutes.
Look at that program.